And we're going to talk today about protecting yourself in this heat. Joining us is Dr. Bruce Black with Baptist Medical Clinic Family Medicine. Thank you so much for joining us
Absolutely,
today.
Stephanie.
Are you seeing patients with heat exhaustion or heat-related illness?
Absolutely, dehydration and some heat exhaustion. Absolutely, we are. You know, the key here is to basically just number one, try to stay out as best as possible. If you must get out in it, if you wait until you're already out in the heat, you're going to, and to start hydrating yourself, you're going to already be behind the 8 ball. So you need to start hydrating before you ever get out there if you must get out in it.
I was talking to my mother yesterday, and she was talking about, of course, my dad's a farmer, and she was saying how hot it is up there in North Mississippi and how she's worried about him. He's 71 years old, still farming. These people who work out in this for a living, how would they know? I mean, even though they've done it for years and years and years, how would they know that they're getting close to a heat stroke or heat exhaustion?
Any type of decreased mental status or lethargy or anything like that is a sure sign that you know that you need to go. You know, you need to contact your physician immediately.
What about sickness?
Absolutely. Any nausea, vomiting, absolutely. Anything like that.
Who's more vulnerable? You know, a lot of times, for instance, my kid had a running camp this morning. And, you know, I was like, okay, this kid, he'll be fine. And then I got to thinking, well, maybe not. I mean, who do we need to worry about the most?
The elderly and the children, possibly, or more than likely, because they have a tendency not to vocalize, you know, when they're in trouble and things like that too. And they can get in trouble with the heat a lot faster than we can.
That's the children, and then the older, why?
Same thing. Also, they're, you know, just their overall muscular strength and their overall, you know, physical well-being is not what ours is, you know, what an adult is.
So what do you do when you're feeling, you know, overheated? What do you do?
Absolutely need to get inside, and you need to start drinking you know, certain drinks, and not just water. I think that you know, a lot of the electrolyte drinks are definitely good, but you also have to be careful for the amount of sugar that you're you know, bringing in a lot of those electrolyte drinks too, if you have any problems with diabetes or anything like that. But definitely not just water, but also some of the electrolyte type drinks.
I know that I have on occasion when playing tennis out in heat and stuff like that, just taken my entire bottles of water and just drenched myself, just cool off.
Absolutely, absolutely. You know, interesting that that's the kind of person that somebody that's used to being inside all the time in the air conditioned is somebody that and then goes out and gets in this and is not accustomed to being in that kind of heat. That's somebody that's definitely you know, inclined to have some problems faster also.
All right, Dr. Bruce Black with Baptist Medical Clinic and Family Medicine. Thank you so much. You're up in Madison.
Thank you, Stephanie.
Thank you so much.
Thank y'all.